Welcome to our daily update. Today, April 27th, 2020, Monday. The summary totals on our overall case count is as follows. The United States, yesterday was like 943,000, today 972,000. That's up about 3.1% change from yesterday to today. Kansas, 3,174. Today, 3,296. That's up 3.8%. And the Kansas deaths as of today are 122. In Sedgwick County, yesterday was 336 cases, and today 339. So we're up 3 cases, which is 0.9%. The counties around us, Harvey has 5, Butler has 13, Cowley has 3, Sumner County has 3, and Reno County has 26. Again, on our Sedgwick County case count, as I mentioned, we've had 339 cases, 170 total recovered, and the death toll remains at 6. Again, a reminder that a person is considered recovered from COVID-19 72 hours after symptoms stop or 7 days after symptoms start, whichever is longer. The Sedgwick County Health Department update. Cluster was identified at Mel Hamilton Ford, 11,625 West Kellogg Drive in Wichita. If anyone visited the business between 8 a.m. and 6 p.m. on Friday, April 17th, or between 8 a.m. and noon on Monday, April 20th, please call 660-7300. That's 316-660-7300, or United Way of the Plains at 211 for further evaluation. There are 2 new clusters identified in Sedgwick County, a business and a long-term care facility. This brings the total of Sedgwick County COVID-19 clusters to 8. The cases and close contacts associated with both clusters have been identified and are currently being monitored. The public is not at risk with either of these 2 new clusters. Sedgwick County, the Health Department is currently taking samples of residents who meet the criteria to be tested for the disease at no cost to the residents. Today, they have scheduled more than 100 residents for the drive-through site. We have the capacity to test more people in the county than what we could do previously. And residents are encouraged to call United Way of the Plains at 211 if they think they should be tested for the virus. If you have general questions, you should also call United Way of the Plains at 211, or you can go for updated information at sedgwickcounty.org, www.sedgwickcounty.org. So Sedgwick County updates, the other updates. The current orders are in place. The governor's stay-at-home order is in place until midnight, May 3rd. That's Sunday.
Deb Ferris.
Hi, Deb. How are you?
I'm doing well. Hey, on the governor's stay-at-home order, she's talking about reopening. Is Sedgwick County going to follow what the governor says, or does the county have other plans?
Well, there's Deb, there's some pretty good rumors going on right now. We're in contact best we can with the governor's office. It's kind of fluid. I think they're taking a lot of feedback from industries and businesses, and her plan, the way I understand it, the county will be able to be more restrictive if they want to be, and not less restrictive. At this point, without seeing the details of the plan, it'd be hard to think to speculate on what we may or may not be more restrictive. So, doesn't really answer your question very well, but we have to see the plan first.
Pete Jacob Albrock, KWCH.
Okay.
Is it time to, do you feel like it's time to get that plan though, if we're going to need to prepare businesses in a hasty manner on what they need to be doing? If the rumors that you mentioned are true, and let's say it's lifted to some degree after this first round at the end of the week, businesses have got to get this stuff implemented. Shouldn't have some sort of guidance by now?
Well, locally, we've had some great guidance from the restaurant world, the restaurant and bar world. If you saw last Friday, they want to impose a 50% of occupancy of their restaurants, plus staff and any outdoor seating. So that's a lot. We've got some great information from our retail outlets, businesses about percent of square footage. And as long as people are keeping the 6-foot spacing, I think that that's kind of where we would be leaning. Churches are doing a really good job of preparing for their gatherings that have multiple seating with 6-foot spacing. I understand there is a conference call or a Zoom call that I don't think is public, but there's a Zoom call between the governor and various church leaders tomorrow morning, Tuesday morning. So there could be more information there. But to answer your question more direct, Jay, we've been very conscious of trying to think we need to announce what either her plan or our plan, and I'm hoping that there's like a 7-day, 6 or 7 day warning. So we've been told by others that they want to be able to make sure their shops and places are clean, make sure try to staff whatever they need to rehire and staff. So I'd like to be able to say today that Monday morning you should plan on being open, but we don't have that information yet to be able to say that. So it's likely there'll be some change. There'll be some delays of a few days.
And then one more quick one for me, Pete. I saw a group of doctors is asking for 7 more days beyond that initial stay. Did you guys get that letter? And I don't know if we know where you guys are, Dr. Menz. Is there any agreement on that, or is it just something being considered at this point from that group of doctors today?
We did receive a letter from the medical profession, and as of now, it's being. We've all seen it and accepted it. I don't know. I'm sure Dr. Menz has seen it, but I haven't confirmed that. We're taking a lot of information that we trust from Dr. Menz and the medical experts, for that matter. There might be some people that say we shouldn't wait 7 days, and others may agree. Maybe others think that it even should be longer. So we haven't been able to act on that yet.
Will you, Pete, it's Deb again, will you have to have your own meeting? So let's say the governor does, outlines her plan, then will the Sedgwick County Commission have to vote, or will we just follow what the governor says at that point?
Well, if the governor's plan is in place and statewide, then that would supersede anything that we did unless we want to make it stricter. We've been talking this morning that depending on when it comes out, obviously we all want to see it right away, and then we want to then we determine that maybe we need to have a special meeting to agree and ask Dr. Menz to endorse the plan if it so requires. But we were going to have a meeting tomorrow, a special meeting, but we have not, because we don't have the information yet. We have a meeting Wednesday. It's on the agenda to be discussed. And if anything comes out after that, then obviously we'll have Thursday and Friday that we can still have a special meeting.
And a quick follow-up, Pete, on all of this. I guess, how are you personally holding up with the pressure and all the decisions that have to be made?
Yeah, Deb, thanks for the condolences. But
sorry.
It's been quite busy for all of us and the staff. Didn't have much of a weekend, And the community's done such a great job. Our numbers are and the businesses, the sacrifice the businesses have made in the community, they've really done a good job. And I guess, and that credit that is why our numbers are so steadily low. I mean, an increase of 3 from yesterday to today. 336, 339. We've been sitting there and increasing 4, 5, 6 a day. So the peak, as Dr. Menz has indicated, has passed, and it's not really been a peak. It was just we kind of plowed through it. But our staff is working really hard. There's a lot of emails that all the commissioners are receiving. It's hard to, you like to put value into each one of them. Some of them are, anonymous, and you can imagine there's all kinds of advice from what to do, maybe where to go if you don't do something. So, but other than that, I think our families are holding pretty decent. And the community, it's a great community, as you all know in the media. So let's hope. I just want to get to the end of this as soon as we can, so we can have some kind of the new normalness, as it's been called, start.
Is there anything you could say to the local businesses who are struggling and even talking about not reopening ever because of what has happened?
Well, those businesses that, if they're not going to be able to open, I sure hope that they exhausted all of the federal programs that were available for themselves and for their employees. That's kind of I feel for those that I've had some information from some that they were too late or have to wait. They can't wait for the next round. And I would encourage every business, big or small, to pay attention to these federal programs that are rapidly available. Our banking community's done a fantastic job of from my perspective, and I've heard from others that have said, well, I got my money, or my business got my money, and thanks to the bank for helping shepherd it through, because the banks do have to eventually receive the money and disperse it. So I would encourage any of these businesses to talk to their banks as well. And if you're, from my own personal entrepreneurial days, it's not fun when I first tried the entrepreneurial world, we lost a couple times, and it's not fun when you lose. So if hopefully they haven't lost their spirit and they're able to bounce back with another chance on another idea, hopefully, would be one of my encouraging thoughts.
Pete, it sounds like, this is Jacob again. It sounds like testing is going well. Case numbers look good. Is the PPE getting better? I know last time we talked to you guys, which would have been last week, we need more. Are we getting more? Any positive developments there?
Well, we're getting, depending on the level of, the degree of like face masks, masking and things like that. But we're taking every call on that, and we're getting a lot of people donating. There's a lot of people selling. One of the things that we may find in the community, especially if we open up for business, I'm not sure that they would be mandated, but I think it's going to be strongly encouraged, at least originally, because we won't know for sure, but to wear masks. Both you wear a mask and the person you're talking to wear a mask. Might make it difficult. If you go to the restaurant, you can't wear a mask and go there, obviously, or eat. But a lot of businesses, you see in Dillon's and the grocery stores and others, have done a fantastic job with their employees. So the new world, if we can get, my best wish would be, do we have enough funds and do we have enough supplies where we could almost provide open up for business packet, where include a mask and gloves and maybe protective outerwear for, you got to think in terms of the hairdressing and the barbers. A lot of them already wear a little bit on their outerwear, but they're going to be challenged because they have their hands in people's heads. One encouraging thing I'd heard from a couple of the hairdressers is that when they first touch a client's head, lots of times they can tell that the person's feverish. So they may end up being a good source of telling somebody, hey, you've got a fever and you need to move on and go get checked, things like that. So we're finding out. I'm learning a lot. And but the PPE is, we're still taking calls and still, I think, Tanya, can I ask, are we doing a little better with the PPE than last week, let's say, or are we about the same? There's a not. Go ahead, Tanya.
That's something I'd have to have Rusty Leeds weigh in on. He's the county manager for public safety, and let me get a call into him and see if I can get some more information on that.
All right.
Rachel from KSN, wondering about the guidelines and expectations, if you guys want to have any kind of restrictions on opening things in waves, depending on what the governor does. Some things that are considered more essential, maybe like hairdressers and things like that, but pure entertainment, for example, like the Sedgwick County Zoo. Are those things that you're considering opening kind of in waves, depending on the governor's decision?
Yeah, well, the short answer, yes. It's easier for event facilities such as the zoo, a botanical garden, that have outdoor attendance. They're actually working on their plans of what they think how they could do crowd control and spacing and keep it effective. A place like Exploration Place is a little bit more challenged because it's indoors, but a lot of their things are interactive. They've got the kids touching things and being part of interactive stuff. So they've all got their unique challenges. I know that I don't think Intrust Arena's got anything scheduled for anything before sometime in July, and that's a big if. So I think the mass gathering numbers is to avoid what it says, mass gathering. We're not doing a chili cook-off downtown, but a mass gathering of, let's say, 10 going forward could be you and your family, or you and close ones, or up to 10 at a church, and then a few pews is skipped, or 6 feet away before the other couple sits there, and then another 6 feet away before somebody else sits there. Similar pattern for restaurants, things like that.
Pete, it's Deb again.
Yeah, Deb.
What about testing? Do we have all the tests we need yet? Or are we still short there?
Well, we're still short, but we're encouraged because, like I said, we're doing 100 tests a day right now. That's a new help. And that testing facility, the drive-up testing facility, what's the address there, Tanya? Can you tell me?
Which one? Where?
The testing facility, the drive-up, for where we're doing 100 tests a day.
Is that the?
It's on West Central.
Sedgwick County Health Department is 2716 West Central.
Okay, that's the testing facility.
And then I have an answer on the PPE. If
Okay,
you want
PPE update.
So I
Tanya?
talked to Rusty Leeds, who is the Assistant County Manager for Public Safety. He says that there is still consumption by all the agencies of the Emergency Operations Center. And so the rate of receipt is still low on PPE, and there's a continual need for PPE. So again, just asking, again, for anyone who can provide PPE to please call into that number that's on our website.
Is it helpful for us to ask people to donate? I mean, that's something, we did that last week. We can keep doing that
If you
to
could,
the emergency management office.
Yes, if you could, absolutely, that would be helpful.
Thank you. Yeah, that would be.
And that's any kind of mask, right? Pretty much is there something else besides the masks?
Oh, I think we would take masks and gloves. And there is a list, I believe, on our website of all of the items that we would take, those supplies of PPE. That information is all on our website, www.sedgwickcounty.org.
Hey, Pete. It's Kirk Seminoff from the Business Journal. Apparently, the governor said a plan is coming Thursday. What would that make your timeline then?
An hour after Thursday when we receive it. I think that would be, I'm hopeful that maybe we'll get an advance draft of maybe a summary of it, so we could get working on it a little earlier than Thursday. Timing, a lot of it, well, the plan is the one thing, and the phase steps is another, but the official start of the plan is crucial from what we discussed earlier. How much advance does how much advance warning do our businesses have to get in place? And are there still some businesses that would not be part of like phase one, things like that? Some industries, who knows? Who knows? If it comes Thursday, then we'll either meet Thursday afternoon or first thing Friday morning. We need to. It's kind of new territory. Not many of us have been in this world, along with you all. Okay. Well, everybody, thanks a lot. I can't tell you how much I appreciate you as the media covering and delivering our messages. It's really, really helpful. The rumors can get out of control, and so everything that you can do to keep sharing factual information is incredibly appreciative, and we'll keep in touch. So thanks, everybody.